today, as we celebrate 30 years of the existence of Joy FM and the Multimedia Group, we say thank you to all of you for being along with us on the way. And of course, what a better day for it to fall on than Workers' Day all over the world. We salute everyone. And as we started the show today, the theme that has been running through is, celebrating the hard work and the industriousness of workers. So just before I go into my conversation, I'd just like to say a big salute to all of our friends, especially those who we see behind the cameras. As I speak to you, we have a minimum of 4 strong gentlemen standing behind the cameras, and they are the ones who put us in shape and frame us up and make sure that we look good. And if we have to start it off, we have to start it off from them. One person I'd also like to salute here is my guest for this morning. Well, Priscilla Akosua Danso is a mother of 2, but most importantly, she is a midwife officer at the Ga East Municipal Hospital in Kwabenya in Accra. Remember that His Excellency then President Nana Addo Dankwa Akufo-Addo, commissioned that hospital as part of the many hospitals that were being commissioned in the Agenda 111 plan for the health sector. So we are going to look at every worker from the lens of this midwife officer whose primary job it is to deliver pregnant women. And of course, away from that as well, there is a pre-period where there's a lot of education done, and a post-period as well, where there's a lot of management done. So today, just relax as you are, enjoy the show as we take you through the moments and the lens of a woman who breaks her back on a daily basis to work in environments that may not be tops, as we see in the developed world, but just keep striving for excellence. Priscilla, good to see you. You look lovely this morning.
Thank you very much.
I like this all-white vibe.
Thank you so very much. You also look very lovely.
Oh, thank you very much.
Yes.
Thank you.
Yes.
Priscilla, you have been in this profession for some years now.
Yes, please. 13 years now.
13 years.
Yes,
That's
please.
amazing.
Yeah.
13 years of work. Let's look at the past year. Let's start it from there.
Okay.
The past year in your space.
Okay.
The kinds of cases you've handled, the kinds of interesting milestones or very weird situations you've encountered. Just walk us through it in the next 2 or 3 minutes.
Okay, so what happens is that on my field as a midwife, most mothers, when they are pregnant, don't really report to the facility so early. So at the late stage of the pregnancy, they come to the facility with a whole lot of complications. So they come with postpartum hemorrhage, they come with pregnancy-induced hypertension, some also come with diabetes in pregnancy, just because they didn't report so early at the facility for us to detect it very early. So whenever they are pregnant, we tell them to report to the facility so very early so that we can get all those complications and then pick routes and then give the treatment very early for them, so it wouldn't give any other future complications.
Interesting. In the last week or so, how many babies have you delivered?
Well, I've delivered last week for about, I would say about 15.
15?
Yes, 15 babies.
Just
yes.
last week?
Just last week.
Okay, so on the average, when you're doing like a whole month, it means you're doing about 60, you?
Exactly.
Wow, wow, wow. Interesting stuff.
Yes.
Interesting stuff. Did you have the passion to go into nursing and midwifery from day one when you were growing up?
Exactly, please, I do. Growing up, as we all grow, our kids, they go to school and there's this career day and stuff. So from the onset, I chose the nursing midwifery profession from onset. And then I quite remember I would be telling my parents after I sleeping, I would dream that I am checking this vital signs for people before they will register them for their SIM cards and other things. So growing up, I said, no, this midwifery really, God has really called me, because the work, if you have not been called, you can never give your whole into the work. So growing up, I realized I would want to be a nurse midwife, and here I am today as a nurse midwife. So I started as an enrolled nurse, that is from 2010. I started as an enrolled nurse, and so I went for the training for just 2 years, and then for the general nursing, and I said no. On the ward, I realized that when the pregnant women comes, I show so much interest in the delivery. So as a general nurse, I was doing deliveries without the certification. So my boss spoke to me and he was like, Priscilla, you are very good in delivery. So why don't you go and then get the certifications and then the license for it? So I just switched from the general nursing to the midwifery side, and I went for the 3 years midwifery program, and apparently I am doing my BSc in midwifery at Wisconsin International University, Ghana. Thank you.
Amazing, amazing stuff. If you just joined us, we're having this May Day Workers' Day conversation with a nurse officer of the East Municipal Hospital. And she is sharing with us her journey, her 13-year journey, which obviously mirrors what could go through the eyes and the mind and the soul of a professional here in Ghana. We've been looking at the early stages. We've also been looking at the motivation to get into this. One key thing that struck me in talking about your motivation was the fact that it was a calling and you saw yourself do this from word go.
Yes.
Does it also mean that you had people around you who were into this profession, or you had maybe like distant relations who were doing this, which became a source of inspiration?
Yes. So growing up, I was staying at West Legon, Kissiman. So there was this school, Health Concern Ghana. Whenever I am with my mom at the shop, I see this nurses pass, and I will be like, Mommy, I said I want to be a nurse midwife. So whenever I see them, they motivate me so much. And then there was one midwife also that was staying around us. The woman is very hardworking, and she also kept motivating me. And then I feel the motivation outside there made me who I am today.
Wow,
yeah.
Amazing.
Thank you.
Let's talk about the element of the calling. You said that you have to have that calling. If you don't have it, forget about it.
Yes.
Is it to say that it is a rough terrain? Because I get that sense that it's a very challenging terrain, and if you're not ready for it, you have to tell me about it.
Yes. So what comes into it is that you have to. First thing you have to get is that you should have interest for the work. One, and then you should be empathetic. Two, you should also have knowledge about what you are going to do. Three, and then you shouldn't be someone that you say you don't like to see blood and those things. If you walk out and say you don't want to see blood, you want to see poo-poo, because at the end of the day, during deliveries, there is a whole lot of blood that will splash on you, excuse me to say, urine, fecal matters, and other things. So we say in our profession, we bath, we eat, we smell, and we smear all these products of conceptions, which are very naughty, but then because we have the interest for the work, we see it to be very normal. So the interest is really a key to this profession.
You are one of passion and, and one of a calling and a great talent.
Yeah.
But have you had a moment where you thought, I want to walk away?
You want to walk away? Yes, I remember after school, I think our postings were not coming. It was just the postings issues. So
you remember which year it was?
That was 2015. Okay. That was 2015. So after completing the enrolled nursing at 2012, 2012, I was home, 13, I was home, 14, I was home. So 2015, I said, so why is the government not posting us? Because at the back of my mind, what I heard was that after school, immediately, especially nurses, after school, you'll be posted immediately. So why are we still in the house like 3 years going? So I was like, oh, then let me go and look for this teaching stuff. And so I went to one school, and then I became a TA for a French tutor, and then RME, and then life skills. So I was there. So immediately I wanted to switch from the nursing to teaching, because I realized that with teaching, even without the training, I can be a pupil teacher. So that was a moment when I realized that no, if the posting doesn't come, I just have to switch to teaching, and then I will be okay with the pupil teacher.
When you went to the school and you were encountering students on a daily basis, what impression did they make on you, and what assessment did you make of the trends in terms of the depth of the students that you were teaching and the curriculum and what impact it was making on them in terms of making them have a very good foundation? Was this at the basic level?
Yes, it was
basic school. A basic school.
Yes,
okay,
yes.
Great.
So what happened was whenever I intend teaching, I would tell them I'm a nurse. So they'll be like, Madam Priscilla, so a nurse and you're in the classroom. So I tell them that our postings hasn't come, but surely our postings will be coming. But I always encourage them to learn so very well. And then I think they did. And I see some of them recently and more times that they have become so great, and others are even in the profession just because I've been talking about them at the profession. But the amazing thing is that whenever they see you outside there, the Madam Priscilla is always Madam Priscilla, because they even see you with a uniform, and because you taught them before, the Madam Priscilla is just Madam Priscilla. So once a teacher, always a teacher.
So if you just joined us, we're having a conversation with Madam Priscilla. And I'm very sure after this conversation as well, you're going to have loads and loads of phone calls, you know, from your clients, the patients, and all these children you've delivered.
Yes.
Tell me as well about satisfaction. You are of a different breed because you have interest for the job and there's passion.
Yes.
Now, satisfaction, tell me about it. What are the things that make you satisfied as a midwifery officer, midwife, and nurse? What are the things that give you amazing satisfaction from what you do?
Okay, so appreciation is one. Whenever we work, at least we've been appreciated. So whenever we've been appreciated, it gives us so much zeal to do the work. And also,
appreciation in which form?
Appreciation and like promotion, like when there's promotion in the work, and then there are some incentives we would have to get at nurses and midwives. It comes, and whenever it comes, we get so much motivated. We get so much motivated, and then I think those ones are there. And then and another thing is that they engage us in these workshops for us to get more insight in the work. Because day in and day out, they are revisions. They revise how things are being done at the ward, and then other things outside there that would help the nurses and midwives to bring it into the society and then Ghana as a large.
Well, you talked about reward, and it brings me to the element of remuneration and job satisfaction, job security, and all of that. Now, you find yourself in a profession which is very fluid in terms of stability. There's no stability. You have loads and loads of your colleagues leaving the shores of Ghana every year, every month, every week, every day to go and seek greener pastures. What's first of all your stance on that particular issue or that particular challenge that we face as a nation?
Well, so what I can say is that I think there should be an increment of salary. The increment of salary is the problem, because we realize that the salary we take as nurses here in Ghana, it's okay, but then at the end of the day, when you take your rent, your transportation, and other things, you realize you are not bringing anything back home. So I think our salaries has to be increased, and then this nurses' incentive should be very effective on our sides. They should bring more load or more packages that would help nurses. Especially, they should get like accommodation for nurses. Like when you are a nurse, at least you should enjoy accommodation for free, or probably they will give it to you and then it will be deducted in your salary little by little. And then we should also get free health service. Because as a nurse, I don't know why I'll work at the hospital and then I wouldn't be fine, and I'll go to the same hospital and I'll pay for my service. At the end of the day, it's
that's what happens, right?
Yes.
You pay for all the services?
Yes, we pay for the service because you'll be told it's a government institution, and then you would have to pay for the service. And then my facility, for instance, when you are sick, the service, like when you spend like 200 cedis, the facility, upon waiving, you get half of your money, which I think is really helping. But other colleagues telling me you have to pay for every service or treatments you gain from their facility is weighing us so much. So it's all based on the salary we are taking from here. So the salary has to be done, like something has to be done on the salary, so that at least when we are working, we work so well. We are trying, we are working, but because the salaries are not so much, and then spending so much on our outcomes and stuff, it's like some people don't really get transportation to work. So when they're forced to work, they are not really productive at work. And then another thing is that we need more nurses and midwives on the ward. It is very key. You realize that those traveling issues you are seeing overseas and stuff, most of them have went abroad. So the staffs are really scant, like we are not so much on the ward. So on this platform, I will urge the government and then any organization that can help bring more nurses and midwives on the facility, at the facility. It will really help our health system, and then it also promotes good health to us.
I want you to draw a personal picture, if you don't mind. So, you have a bit of a different scenario because, if I'm not mistaken, you live not too far away from your office, which is the hospital.
Yes.
Okay, so you live in the vicinity.
Yes, please.
How long does it normally take you to get to work in the mornings?
Oh, in the mornings, about 30 minutes. Like 30 minutes will be fine.
30 minutes?
30 minutes.
You get to the office?
Yes.
Okay. You use public or private transport?
Public transport, sometimes private as well.
Okay, you own your own car?
Yes, please.
Okay, very well. So you balance between the two?
Please. Yes,
okay, so you spend money on fuel, you spend money on public transportation.
Well.
Okay. Now, your kids, where do they school? Do they school in the vicinity or they school outside of it?
They are in the vicinity, but not too close to it. So what happened is that, as I said, I'm a mother of 2 and I'm living with my kids. So they joined the school bus. Joined the school bus. So I tried as much as possible that after waking up, the school bus picks them, and then I also follow suit to my workplace.
Do you have colleague nurses who have to, for instance, travel like an hour or more?
A lot of them.
A lot of them?
A lot of them.
I see.
Some come from Ebri.
Ebri?
Yes. Some come from Ebri. And because accommodation here in Accra is too expensive, and as I said about the salary, they would rather love to be their family houses or their homes and then travel all along to Accra here. So they don't really want to stay here just because of the accommodation in Accra. Because in Accra here, getting even a single room now, it's like 800,000 cedis going. And I feel they are spending so much on it, and then on the utilities, the rent, transportation. So it's better they go. So most of them, what they do is that they request for night duties. You see, so when they come for night duties, for 4 days, they have 3 days off. That is what happens. Because when you come for mornings, afternoon, travel all away from Ebri, some from Koforidua to Accra here, is so hectic for them. Yeah.
Well, Priscilla Akosua-Danso is the representative of all workers in Ghana as we bring you this special here on Prime Morning. Today, we want to celebrate workers. We want to celebrate the real stories. We want to celebrate the ability to rise from the challenges that confront you on a daily basis. And we want to inspire you to reach for more and see development of the nation as one, which is a collective responsibility of which you are a part. Priscilla is with the East Municipal Hospital. So anytime you are around there and you have anything that has to do with childbirth, you have to go and look for her and ask her to sign an autograph for you as well, because she's a star. You know that, right? Yes. Look, let's talk about the temptations to want to walk away from this profession and from this space. Many of your colleagues have left.
Yes.
How many times or how often do you get the offer to want to leave to, let's say, the UK, because it's one of the biggest places where, or the most preferred place when it comes to your profession and friends who are running away or moving away and migrating?
Yes, so for the offer, it always comes. Even this morning at the office, I received 2.
You received 2 offers this morning?
Yes, please.
Wow.
They
to go where?
UK and the one from Canada.
I see.
Yes. So it's always coming. It is always coming. Because
And the package is, let's just do a bit of calculation and try to do a few, variations here. The package, I mean, if you have to, divide it, or you have to do multiplication or division, how big is it compared to your package, if you look at it yourself?
Yes.
What has been put, the offer that has been put on the table for you?
Yes. So for the offer, I would say the outside offer is better than here, because if I'm dividing,
it's about what, 3 or 4 times bigger?
It's about 4 times bigger than
4 times bigger than what you're getting here.
Yes.
Okay, great.
It's about 4 times bigger. But all the same, they are also having problems with their incentives there.
Okay.
The taxes and other things. But they keep encouraging that I should move out, because aside taking the taxes and other things out from the salary, they still gain more than here.
More than here?
Yeah.
Okay.
So they encourage I
Now, does this package that you're receiving include facilitation for your children to also go with you?
Exactly, yes.
I see. So then what will be the motivation for you to continue to stay on? Because, as you've said, the whole package compared to what you're receiving here, the whole package is 4 times better.
Yes, please.
And that includes your children. So psychologically, I mean, your immediate family setup is also taken care of.
Yes.
So what's the motivation to continue to stay here? Tell me.
Okay, so the motivation that I will continue to stay here is that I would urge the government that at least, even if they can do something about the health system for our children and then probably our next of kin, because as I said earlier, even we nurses, when we go to the health facilities, we do pay. And our children also pay. So I would plead that even if our kids comes to the hospital, they should try and then waive the bills for us so that we get it from there. Because outside there, what my colleagues are telling me is that you take the children, like everything is covered. They will go for health facilities for free. You just be home, and then if the child is not fine, you just have to call your doctor, and then you'll be booked and then see the doctor. And it is free.
So once again, I just still want to get a bit more detail about what it is that sets you apart from all your other colleagues who are going away. Because, like, who doesn't like to be comfortable? Everybody wants to be comfortable. Everybody wants that security and that environment where you're better appreciated. So what could be that factor that is still keeping you here and keeping you committed to Ghana and to your health facility and the many patients who come to you on a daily basis? Okay,
so I am seeing it this angle that now that I have passion for the job, I'm here, and then I feel I have to help Mother Ghana, because this is where I gain my training from. If I am also leaving, who takes care of the sick people here? So I feel I have to stay behind and then take care of the sick people, the pregnant women, and also my family members. So as a nurse midwife in my family, as I'm leaving my family, who takes care of my family? So those are the things that are keeping me here in Ghana.
Amazing stuff, amazing stuff. Let us talk about the future. Let's talk about tomorrow. You find yourself working in probably one of the best health facilities you can find in the capital. And obviously this is urban, in the urban area. So obviously you have better conditions or better infrastructure to work with. What word of encouragement do you want to give to your colleagues? I mean, we recently heard of the story that came from the Tamale Teaching Hospital and all the other places where they have to work through so much inadequacy. What word of encouragement would you want to give to them?
Okay, so first of all, I would say that congratulations to everyone, my nurses and midwives out there. I said, Ayiko, may you continue doing your hard work. I know you are doing so very well. So what I would have to tell them that they should continue whatever they are doing, because people are looking at what they are doing. They are doing so very well. Those that are doing good, they are being spoken about, and those that are not really trying, they are being spoken about as well. So I want to encourage everyone out there, my nurses and midwives out there, that they should keep on doing the good thing they always do, and God in heaven will reward them. And then even on earth here, you'll be rewarded.
Well, I'm looking at the screen right behind you, and I see the managing director of FBN Bank, Mr. Victor Asante, and he's also president of Rotary, and he is giving you, a plaque. I want to believe that this was a speaking engagement because I've done a couple of speaking engagements at Rotary.
Yes.
You did a speaking engagement. Yes. Tell us about this picture.
Okay, so it was about an October where we would have to talk about the breast cancer awareness to the whole public, and then it was fortunately that they invited me to talk to them about breast cancer. So I went and then I did the delivery on breast cancer for them, and then they were really happy because the men were also present that day because they were thinking the breast cancer was just for women, but for my teaching and then my presentation, it also gave them or enlightened them that even men can also get breast cancer. So I really presented so well. They were also very happy about that, and that is the picture we are seeing out there.
Wow, amazing stuff. And Priscilla, looking as beautiful as she's looking this morning, right in the picture there, with Rotarian Victor Asante, who's also the managing director of FBN Bank. Amazing stuff there. Let's talk a bit about family, about social life and all of that. You find yourself in a very tough terrain, a very difficult terrain, but your passion is carrying you through every day. Mm-hmm. Do you ever meet any persons in town who say, "Oh, you delivered, my mother says you are the one who delivered me," or you meet a mother who says, "Oh, this is the child you delivered"? You meet some of them?
Yes, a lot.
Tell me one experience.
So what happened was, there was this mother who was pregnant with twins. So at the facility, the mother wasn't really coming so well. So the doctors and the surgeons were like, "Oh, Priscilla, let's take this woman to the theater and then cut her because she has this twin delivery." And unfortunately, one of the twin was coming cephalic, which means the baby was coming with the head, and the other was coming with the buttocks, which is the breech presentation. So I'm like, I will maneuver my ways out and do this delivery for this woman. So the first baby came, and then the second one took me like 3 hours. So this doctor will come and whisper, Priscilla, PPH, Priscilla, let's take the woman because this one is bringing the buttocks. Let's take the woman. I said, "Doc, since I have made this woman lie on this bed, I will use my maneuvers I've been taught in the classroom and I'm going to do this delivery." Unfortunately, doing the maneuvers and everything, the second baby came. So the fortunate thing was that where my children schooled, I was taking my kids to school one of these days, and I saw the woman, and she mentioned my name, Madam Priscilla. And I said, "Auntie," I said, "Okay, me." And I said, "No." I said, "Hey, when I was in my warm manta for now, I say, hey, so we're all jumping." I said, "Where are they?" And these kids were all grown all over the woman. Wow. So I feel so excited when things are not really going on well, and you use your academia, your practice, your experience to maneuver things, and things go so well. Yes. Madam
Priscilla. There are many Madam Priscillas all over, and through our eyes, we've seen workers this morning. I'm going to ask you about your favorite song. If we have, what's your favorite? Do you have a favorite song? Do you have a favorite artist?
Yes, I do. Daughters of Glorious Jesus.
Okay. Daughters of Glorious Jesus. They've been consistent, and talk about experience and consistency and longevity. Yeah. They are one of the groups you should salute. They've been in this industry for a minimum of about 40 years. 40 years ago, where were you? I've seen some of my friends behind the camera smiling at me already. Your kids, how are they doing?
They are doing so very well.
How old are they? What's the age?
9 and 7. 9
and 7.
Yes,
okay,
please.
So they are in primary school.
Yes, please.
I see. Are you? What's the spread? Male, female?
Female.
Both two girls.
Two
okay.
girls,
Okay. Yes. You want one of them to take after you? I know parents like that.
Yes, I have their pictures. So one of them, the big one is saying she will be a midwife, and she's a midwife, and the little one is a lawyer.
Wow, yes. Amazing stuff. What are their names?
Inshiraba.
Send them a message.
Okay, so Inshiraba and Adepa, I love you so well. I love you so very much.
Wow.
So I'm extending the greetings to you. And then Uncle Junior, they are at my shop currently. I am a nespreneur.
Oh,
I'm also, yes, operating a shop. And then
what do you sell?
I sell electronics like blenders, rice cooker.
I'm going to come by your shop one of these days to buy something, something, one of them.
All right, so they are taking care of the shop. So as a mother, as a student, as an entrepreneur, and as a worker, leaving the house, those dawn, they came to wake me up in Shraba and Adepa. You did so very well. We didn't sleep early last night. So they came knocking my door. Mommy, you'll be going to Joy Primo. It's 4:30. We are done bathing and then
wow. So our lead producers for today in Shraba and Adepa, thank you so much. Yeah. And big salutes to you as we celebrate this day. Priscilla, thank you so much. Madam Priscilla, thank you so much. Priscilla Akosua Danso is a midwife officer at the Accra East Municipal Hospital. My guest this morning for the May Day conversation as we celebrate workers from all over the world. We'll try our best to wrap up with, with something from Daughters of Glorious Jesus if we can. But you stay well. Thank you all so much. It's been wonderful and amazing sharing your company this morning. And once again, big salutes to all workers in Ghana and around the world. You make the wheels move. My name is Nathaniel Atto. Tomorrow, we'll be sending you into the weekend with another amazing and must-watch edition of Prime Morning. Thank you.